We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home of many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this island. I'm happy to introduce Dr. Fan Liu and Dr. Heather Shapiro, the program co-director, to share the program information with you.
Hi, everybody. Hello. So I'll get started. I think Dr. Shapiro is a little delayed, so I'll get started. So my name is Dr. Fanny Liu, and I'm the program co-director and I'm responsible for the pathologist assistant field, while Dr. Shapiro is responsible for the clinical embryology field. And then for me, so I'm also a practicing pathologist. I work at Sunnybrook Health Sciences Center, and my specialty is in breast pathology. And you can see here, I'm also interested in education and in digital pathology, obviously in breast pathology research as well. Maybe the next slide.
Yes, Dr. Shapiro is also here.
Oh, okay, perfect. Heather, you want to say something?
Sure. Good evening, everybody. Thank you for joining us. Hopefully, we're going to be able to answer some questions for you that you might have about this profession or about this program, and hopefully make you very excited and passionate about something that we are also very excited and passionate for. So I'm not going to say too many specifics. We've purposely designed this so that we have breakout sessions where we can have some one-on-one conversation, and I'm going to leave it to our people who are doing this work to tell you a little bit more about what they're doing. So I think what you probably already know, but just to review how we see things, that this master's program gives you an opportunity to really work with essential healthcare. Both clinical pathology and embryology are multidisciplinary teams, and you have an opportunity to work with a very good group of people in a great team setting. For some of the programs and the PA program and to the CE program to a certain extent, you might be looking at other programs that teach a similar kind of curriculum. But frankly, we really think we have the best clinicians and the best teachers in our program. We have seasoned clinicians, we have senior teachers, we have people who are focused on teaching stream, and the curriculum is really highly developed with a very specific purpose to provide you with the tools you need to be this kind of professional. But not to underestimate what I think is a big part of tonight as well is the career mentorship. So there's a very tight bond between the students and among the alumni, and I think it really helps people get through what can sometimes be tough times in education and help them look towards the future. So I'll just let you read this, but I think everybody probably has a pretty good idea of what the two streams are, and hopefully by the end of the night you'll have an even better idea of what the two streams are. Okay, we can go on the next slide probably. So again, I'll let you read this over while I talk. But I think that what we want you to know about us is that we are part of the University of Toronto, which has a long history of creating leaders, which has a long history of very high academic standards. And those are the skills we want to be able to pass on to you. So this is a very technical field, both being a PA and a CE are require technical skills, but more importantly, we really see you as clinical laboratory scientists, and we want to equally develop that scientist part as that laboratory part. And on that note, I think I'll hand it over to Will.
Great, thank you, Heather. At this point, I will just talk a little bit about the PA field, um, uh, and then you will also hear from from one of our alumni as well, Paulina, to talk about her experience as well. So. Um, I just want to do a quick introduction about myself. My name is Will. I'm the field director for the pathologist assistant field, and I'm also a practicing pathologist at Mount Sinai Hospital. I did my undergrad way back in the day at the University of Toronto at Scarborough campus in molecular biology. And then I subsequently completed my master's in pathology at Western University in pathologist assistant, and I've had the opportunity to work and practice in a few different areas and places, community hospitals. I've done a little bit of forensic autopsy as well, and currently working in an academic center, specifically at Mount Sinai. And I also hold PA certification in both American certification as well as Canadian certification. So my brief talk today, I want to just give everyone a better understanding about the role of a pathologist assistant and highlight a few key aspects of our profession and kind of what we do. And kind of go over what it's like to work as a PA and to be part of our community. I'll emphasize a little bit about the skills that's required to be successful in our field, and I'll round out with some of the highlights of our program specifically. So, who are PAs? So, kind of despite what our job title alludes to, our function is much broader than kind of like what our job title alludes to, a pathologist assistant. We're more like physician extenders. So we operate as a member of the pathology team with practical knowledge and advanced academic training in not just pathology, but also anatomy, physiology, and pathology, of course. Our main responsibility is to provide accurate and timely processing of pathology specimens, and we specifically work under the supervision of board-certified pathologists, mainly in Canada. We're sort of spread out in various academic teaching hospitals, community hospitals, forensic pathology units, where we perform post-mortem examinations, and there are also some private pathology labs that also employ PAs in Canada. So the main role of a pathologist assistant is sort of two sides of the same coin. The first side is surgical pathology, and the other side is autopsy pathology. So in surgical pathology, we perform macroscopic examination, documentation, and dissection and sampling of any tissue that's removed from patients, whether it be small biopsies, small samples from any part of the body for diagnosis, to smaller excisions such as appendix and gallbladders for any sort of injuries or illnesses, and up to any larger resections such as a hysterectomy or removal of the uterus, colectomies, pneumonectomies, and Whipple's resections for most likely, or more commonly, I should say, malignant diagnosis, as well as larger multi-organ en bloc resections for locally advanced cancers as well. So the other side of the coin, as I mentioned, is autopsy pathology. So PAs also participate and assist pathologists with autopsy duties, which include evisceration, dissection of organs, and sampling of procured tissue. We also have specialized training in toxicology sampling for ancillary tests, such as like performing sampling blood work, vitreous humor, for example. And also we assist in rendering macroscopic diagnoses in certain cases as well. There's a sort of a new role that's emerging in the United States, where the American Board of Medical Legal Death Investigators have created a new designation for pathologist assistants who are specialized in forensic pathology. For some of the PAs who have this specific designation, they're actually trained to even do autopsy or forensic autopsies independently from pathologists. So there's as you can see, the role of the PA is always growing and evolving over the years. And on top of all of the on bench duties that we kind of do, PAs also have numerous other roles that we also do as either like a team lead or a lab manager for some of the more seasoned pathologist assistants, managing day-to-day workload in a lab environment, and really being sort of like the lab expert within the pathology department. So kind of assisting pathologists in handling any queries that are outside of pathology, sort of interdepartmental queries about what kind of tests or word it sends certain things. We most often end up being the person who kind of answers those kind of questions. Education, especially in teaching hospitals, this is a very big part of our job as well, to teach basically any learner that comes through the pathology lab, whether it be pathology residents and fellows, other PA students in this program, and other allied health, such as medical lab technologists, medical lab assistants, and some high school volunteers who may find themselves in a pathology environment as well. And other things that we kind of dabble in a little bit about research, with specifically with tumor banking, quality assurance, and doing some consultations as well, such as intraoperative consults with surgeons. So I'm just going to switch gears a little bit and give everyone a very general overview in terms of like how disease is diagnosed, like kind of what happens in a pathology lab. I want to highlight the fact that pathology itself is a very old stream of medicine, and it's still not very automated compared to some of the other branches of medicine. So as I kind of mentioned, anything that is removed by a physician always ends up in pathology for examination. So once the tissue is removed, it actually makes its way into the gross lab, and that's mainly where PAs kind of work. So we're sort of like the first person to examine, either handle with our hands and look with our eyes to see what is submitted. And based on the clinical history, we will document, selectively sample the tissue according to very specific protocols. Once the tissue is sampled, it actually moves into the lab process where we basically turn the physical tissue into glass slides. Okay, I'm sort of being very generic with the process, but it goes through the histology lab through various cycles of processes where we fix the tissue, we process the tissue, and embed and cut the tissues into very, very thin slices. And these slices are mounted on a glass slide where we stain the slides, and it allows the pathologist to examine these very thin slices of tissue under the light microscope and generate a diagnosis. So looking at individual cells at that kind of level to render a diagnosis. So the profession of the pathologist assistant is still relatively unknown to the public, and sometimes even among healthcare professionals. Our role has sort of been created to fill a need in a healthcare setting where about 25 years ago, the PA profession was still not quite mature, and a lot of the pathologists were still doing jobs that PAs do now. So we generally act as the liaison now between pathology labs and other departments, as I kind of mentioned, to sort of ensure this quality of care. There's still a fairly high demand for PAs in Ontario and Canada as well. PAs ourselves were sort of a uniquely North American position where it's not very common in Asia, but there are more and more places, especially in Australia and New Zealand, for example, and in some parts of the in Europe, where they're starting to create these kind of physician extenders in pathology, so i.e. PAs. Currently, our medical profession is unregulated, but we are growing on numbers in terms of the number of formally trained PAs in master's programs, and workplaces are currently looking for graduate level trained PAs to support their lab environment. So jumping ahead to how our program is structured. So the program is structured in sort of like two phases. The first phase, or year one, is generally full course load, where our students will take a variety of courses, including anatomy, pathology, bioethics, and biobanking, to name a few courses. Year two is where we kind of switch gears, going from course-based to practical apprenticeship style kind of learning, where students will kind of hone their skills through numerous clinical placements at many of our affiliated clinical sites in the Greater Toronto area. And at the same time, we also have our students partake in a capstone research project on the side as well. And once your placements kind of finish within that year, we have that extra semester where we have our students take a clinical lab management course, as well as time to round off their capstone research project as well. These are just some of the pictures that I've taken from some of our previous cohorts while we participate in some of the academic half-day exercises that we hold every year. This is something that is, I think, a very great part of our program, where we not only have a lot of physicians and pathologists educate our PAs, but we also have a lot of PAs who work in the various hospitals participate in sort of some of the teaching as well. So these are some of the exercises that we do with our students, where we do some review of live specimens that you kind of just saw, as well as doing some plasticine model exercises, where we can teach the students how to take apart, in this case, this is a Whipple's specimen. So it's a removal of multiple organs, including the pancreas, the duodenum, the distal stomach, for pancreatic cancer. So a relatively difficult and complex specimen, but we're sort of utilizing Play-Doh in this case to kind of emulate the dissection process, and to also educate our PA students in terms of like the standard of practice, as well as the complex anatomy as well. So specifically for U of T, I think we sort of pride ourselves with the variety of resources that we have at our disposal to kind of educate the next generation of pathologist assistants. And we're very happy to say that our program is accredited by the National Accrediting Agency for Clinical Lab Science, which is an American agency. So all of the PA programs in North America have this accreditation as sort of like the gold standard. So all of our graduates are eligible to challenge for the American as well as the Canadian certification exams. So these are just some of the things that I think that prospective students can think about if they're interested in our program. I think it's a career that definitely is very fulfilling, and it requires a lot of continuous learning, as medicine is always moving forward. So I personally think it's probably the most fulfilling part of my job, is to be learning continuously and not be stagnant. And finally, some resources, should you be interested to learn a little bit more about our profession, some of the Canadian resources, as well as the American ones. And that's it for me. Okay, thank you all for listening. And I'm going to hand it over to Paulina, one of our alumnus.
Hey guys. So thank you for coming to this talk. hopefully I can share a little bit of insight about the program from my perspective as somebody who actually completed the program. So I went to the U of T PA program and I graduated in 2023, so just over a year ago. And I currently work at the Jewish General Hospital in Montreal, which is an affiliate of the McGill University Health Center. So I'll talk a bit about my educational background. I completed my undergraduate degree at Western University in 2021. It was a Bachelor's of Medical Science and I specialized in pathology. So I actually found out about the PA field in my undergrad degree. And then I applied to the PA school at U of T and I started that right away after my undergrad, and it's a 2-year program, so I completed that in 2023. And now, like I said, I'm working as a PA at the Jewish General Hospital in Montreal in Quebec. So I'll talk a bit about why I chose PA. So I said that I discovered the program through my undergrad degree. I was doing my undergraduate in general medical science, and then in the last 2 years, I specialized in pathology, but it was all just kind of courses about general pathology, environmental path. I really liked the field, but I wasn't really sure what my options were as a career. And then we kind of had something similar to this, like a career day where they talked about possible careers in pathology. And the PA career really caught my attention. The reasons for that are listed on the slide. So I thought immediately that it's a very interesting discipline. And like Will said, it's just like anything in medicine, but I think the pathology field of pathology especially is kind of an ever evolving discipline. So you're constantly learning, which I like. I also like the fact that as a PA, you make a direct impact on patient care. So even though you're not working with patients in person, your job is contributing to their diagnosis and therefore to their care, which is something that's important to me. Next, the fact that the PA field is a fast-paced work environment and you get to work with a lot of different people. So I find that really cool. On the day-to-day, I get to work with nurses, surgeons, other PAs, medical lab technicians, pathologists, radiologists. So a whole group of medical professionals, and you kind of get to glean some insight from all of these different people. It's very interesting, keeps you on your toes, and it is very fast-paced work. So depending on the hospital you work in, your caseload may be high. There's so many different types of cases. Every single day you're doing something different. And finally, and probably most importantly to me, I really like that it's a hands-on work environment. Even though you're not working directly with patients, you're, like these photos show, working directly with patient samples. You're literally looking at physical organs or parts of organs or multi-organ resections, and you get to kind of see the disease with the naked eye and how it affects the structures of the tissue, which I find fascinating and really engaging. So those are kind of the reasons why the PA field really attracted me, and hopefully those are similar reasons to why you guys are considering it. So now I'll talk a bit about why U of T. So we kind of covered like why the PA field itself is really cool. So why did I choose U of T and why you should? So something that appealed to me about U of T is obviously the small class size. So you're actually in a group of 5 or 6 students, which is really awesome. You get to really get close with your peers. I'm still very close friends with all the girls that were in my program in my year. And you also get a really good relationship with your professors and your proctors, because you get a lot of one-on-one or kind of 2-on-1 time, which really helps your learning. I really also like the fact that the U of T program has an emphasis on research, which is unlike the other PA programs that are available in Canada. I found that the U of T program has kind of a bigger emphasis on research, which, although research isn't part of your daily day-to-day kind of task as a PA, it does really help teach you how to think critically. So we took a lot of courses related to research, like a stats course, research methods course, and of course we participated in a capstone project. And specifically the latter, the capstone project, really helped me kind of gain a deeper understanding of pathology and the processes that involve the lab. So I actually think that's a huge benefit of the program. I didn't really love research going into my master's, and I wasn't really excited about that, but I came out really liking it. So hopefully that'll be the same for you. One of the biggest highlights of the U of T program is that you get to rotate through, I believe, 7 different clinical sites throughout your second year. that's a huge benefit. Unlike some of the other PA programs that I looked at when I was applying, a lot of them, you're kind of stuck at the same hospital for your entire clinical year, which is fine too. But I really liked coming out of the Toronto program, I really liked the fact that I got to visit all these different hospitals and kind of spend, I think it was 6 weeks at each site. You gain a little bit of insight from each hospital. Each hospital does things a little bit differently, and you'll see things that you like and things that you don't like, and you'll get to learn from different teachers and kind of get a little bit of insight from all these different people that will eventually come together to kind of helping your own practice. And to this day, I still like little things I do in my own practice are attributed to the different teachers and different sites that I rotated through. So I think it's very it kind of gives you like a wholesome learning opportunity, and you get to kind of see how different people do different things and gain a lot from that. So I actually don't believe that any of the other PA programs in Canada offer that, and that was a huge benefit for me. And finally, like Will kind of talked about, there are a lot of different resources and modules that supplement the learning. So like the thing that he described with the clay, where we learned how to gross a Whipple, there's all these different kind of hands-on modules that they supplement our learning with. And overall, I found that when I came out of the U of T program, even though I was obviously still very fresh and I learned a lot as I started my first job, I kind of had all the necessary background knowledge to begin my career as a PA. So I'll talk a bit about a day in the life of a PA, at least for me. So like I said, PAs in different sites will kind of have, their roles will differ a little bit, but this is kind of how my role looks at my current job. So in the morning, I will kind of look over the cases that I'm assigned to. And then if any of them are complex or I feel like I need kind of a consult, I will review them with the pathologist or the other more senior PAs on my team. And then I spend my day grossing my cases one by one. So basically, grossing a case involves looking at the specimen and making a gross report on the software, where you kind of describe what you see, describe the disease, how you think it affects the different structures of the specimen. And then you'll take sections like we'll describe from the specimen, which later get turned into slides. At the end of the day, the pathologist will receive those slides and will receive your gross report, but they never actually, unless you ask them for a consult, they'll never actually get to see that specimen grossly. So your job is really, really important. And whatever it is, like if you don't catch something, then the pathologist might never see it. So at the end of the day, the pathologist is using the slides that you created or helped create and your gross report to come up with a diagnosis and to stage the patient in the case of cancer. So that's kind of like just a brief overview of grossing a case. So I do that for all my cases. And then at the end of the day, I'll work on small cases such as biopsies. I'll review and edit my gross reports. I'll make any necessary diagrams. And then some of the ancillary duties of a PA at my site involve teaching students. So we have a lot of different learners that come through our site, anywhere from like PA students or medical students, as well as pathology residents. And we do go over specimens with them and teach them how to gross. This is more reserved for more senior PAs, but I do end up teaching a lot of the learners and kind of just showing them what I do. And then finally, this is not really part of my role, but the senior PAs at my site are also involved in like inventory and purchasing. So going over all the lab supplies and making sure that everything is stocked, and then any purchasing, they're in charge of that as well. And then finally, I'm just going to go over some tips for success in your application. So I get a lot of messages on LinkedIn and Facebook and stuff from prospective PA students, and they're always really eager and like asking me questions about what they could do to stand out and be successful in their applications, as the process is kind of competitive. And these are just the things that I always tell them. So one of the most important things that I found helped me in my application process is being very familiar with what a PA does. It sounds kind of like obvious, but like Will said, the PA field is not very well known, even by healthcare professionals. And it's also a very niche profession. It's something that isn't for everyone. And so the application team really wants to make sure that you've taken the time to understand what a PA does and that you genuinely think that it will be a good fit for you, because it would be a shame if you were to enter the program and then you realize that like it's not for you. So ways to do that are to obviously go on the internet. There's tons of resources and they'll talk about like the PA programs and what PAs do. Obviously, attending information nights such as this one is a great step. And then finally, if you can, do any shadowing, meaning like if you're able to get a position at a hospital, just to kind of watch, maybe come even for just like a day and visit a pathology lab and see what PAs do. I think it'll give you a great understanding of, or a better understanding of lab workflow and the PA job. I know that's hard to get and it's absolutely not a must. Like I didn't have any shadowing experience, but if you could get that, that's great. And then finally, there are opportunities to kind of volunteer at hospitals where you might get to not necessarily work in a pathology lab, but maybe work with other pathology professionals or kind of just, again, like take a tour of the pathology lab. So if you could do that, I think that's a really good idea. And it'll help you understand what like the PA job entails, and further help your application. And then finally, just like the obvious stuff that apply to all work program applications, just being honest and being yourself. You don't have to get involved in any extracurriculars you don't actually like because you think it makes your application look good. Just get involved in things that you can stay consistent at and that you like, and that'll show that you're like a consistent and great applicant. So I was in my undergrad, I was involved in things that were really unrelated to pathology, but that's something that I talked about during my interview and just kind of showed that like I'm a well-rounded person and a well-rounded applicant. So that's kind of all I have for tips for success. But after this, we're going to have like a breakout room session and I can answer any more of your questions about the profession or the program. So we can move on to that soon. Thanks for listening.
And Will. Now I'll pass the time to Dr. Hamilton and Cassandra.
So thank you very much, Will and Paulina. I think I'd like to apply for the PA program, but I'm worried about the age cutoff. So I'm going to talk to you as a well-seasoned clinical embryologist and an avid participant in this program. I luckily for the CEs, I actually get to participate in significantly for 4 courses over the 3 terms, I guess 6 terms. And I participate in like minimal roles with the PAs as well throughout it. So I very much enjoy this program, highly recommend it. And so I'm going to tell you about life as a long-time clinical embryologist. So clinical embryology is rewarding, challenging. Most of you probably have heard of Robert Edwards. He's widely believed to be the first clinical embryologist. Gets half the credit for the first test tube baby in 1978. But there was significant help from Jean Purdy, who actually may have been the first real clinical embryologist, the others being a physician and a scientist. Since that time, the field experienced explosive growth, and it continues to grow. And I've watched it personally since 1990, which is actually pretty early on because it took a little while for the rest of the world to catch up to Steptoe and Edwards. It evolved with individuals from research fields that mostly involved animal science. We had basic science knowledge, research applications that could bridge the gap between research science and clinical application. And until recently, most new clinical embryologists learned through essentially an apprenticeship program where we needed help and we taught people the hands-on skills and they picked up some of the helpful information as they went along. Programs such as our current one now hope to develop new clinical embryologists that have a very good basic science basis and the ability to develop some hands-on training. Work input into the embryology laboratory is based on fertility treatment cycles. Current cycles or cycles intended to bank gametes or embryos for the future, and then cycles that actually use those. Physicians and clinical teams coordinate the ovarian and uterine cycles to generate optimal retrieval of suitable gametes, or the return of embryos. So embryology cycle work, which is some kind of cycle type, it includes oocyte retrieval or oocyte thaw, in vitro fertilization, assessment of embryos and embryo transfer, thaw and transfer of frozen embryos, and gamete freezing and storage. Now put that into one paragraph, but there's a lot involved in that. And there's various optional variations that can be used. Maybe use frozen gametes or donor gametes, maybe add some genetic testing. There's add-ons, right? Time lapse, and there's things in the future that we don't even know about that can be added on. So in thinking about the clinical embryology work, you need to remember that the human pregnancy, it's about 280 days. The menstrual cycle is about a month, or about 28 days. And the clinical embryology team participates in 1 week of that process. If you throw in the physician component of it and actually seeing what's coming, it probably covers most of that 28 days. But it's a very small section of time to do a lot of important work. And if we look at the menstrual cycle and then very early pregnancy and where the clinical embryology component of that might fit in, the menstrual cycle is 28 days. Kind of the first half of that cycle is follicular development, and the clinical team participates in assessing and fostering, hopefully, the development of maybe a larger number of potential eggs from a larger number of developing follicles. So that's about the first half of the cycle, maybe 10 days we're looking at it. Then if there is a potential mature egg that results, even in a natural cycle, it's released into the the uterine tube, halfway through the cycle. And if somebody is trying to achieve a pregnancy, maybe insemination happens and fertilization happens very early on the next day. So 5 days the embryo spends in that uterine tube, and before the end of the first week, if all goes well, it's reached a blastocyst stage, or it drops into the uterus and completes the final steps to reach that blastocyst stage, and implantation occurs in the uterus. When clinical embryology steps into this, you're actually taking eggs from the ovary, and that's a physician that does that. The clinical embryologist gets the eggs, and we look after that kind of 7-day period. And there's the easiest form from the Robert Edwards, Jean Purdy days was to take a solution of well-prepped sperm derived from semen and squirt it next to an cumulus oocyte complex. So that's an egg with some ovarian cells surrounding it. And this still represents a significant number of clinical embryology cycles that happen in our labs. Alternatively, and it wasn't that long afterwards, if there's not very much sperm or there's concern about sperm getting into the eggs, you can actually pick up a single sperm and poke it into an egg after you take the cells off the outside. And you put one sperm into the egg, and everything afterwards is similar for conventional or intracytoplasmic sperm injection. And you watch fertilization to ensure that it's normal. So a nucleus from the sperm, a nucleus from the egg. You watch that the embryo divides from one cell up to a few cells, 8 cells by day 3, differentiates into maybe a blastocyst before the end of the first week, and then an embryo transfer. The egg retrieval is an ultrasounded guided procedure, again carried out by a physician, where a vaginal probe shows a very good image of the ovary, and you can see an ultrasound image down here, and it shows large follicles, which are mostly fluid. And if you look at the cartoon version of this, this is what you're looking at. The needle goes in, it aspirates the fluid, and the egg that's inside the mature follicle will be lifted off into the needle, goes through the tubing, and ends up in a little test tube. That will happen if the egg is mature more than 90% of the time. Often the clinical team will drain smaller follicles, and at a certain point, it's immature enough that the egg is deeper into the follicle, and it's less likely that the egg will be retrieved from that. But clinical embryology is dealing with what gets into the tube here. And these are the hands of a clinical embryologist, lovely hands, lovely purple gloves. And what we get is a solution that contains follicular fluid. There's a little bit of blood in the follicular fluid because it is well perfused. And there's a bunch of components that are like plasma that are in the follicular fluid. And somewhere in there is an egg or several, and depending on how big the follicle was and how many were drained, there might be several eggs in that particular tube there. Clinical embryologist takes that tube. The other component is sperm. And sperm, most of the time, comes from semen. Yes, you can get it from testicular procedures directly from the seminiferous tubules. But you're processing that with mostly semen in a biological safety cabinet, because semen does have a very minor infectious risk, despite extensive testing for potentially transmissible infectious diseases. So you're working in a biosafety cabinet. You need a centrifuge, you need some test tubes, you need some appropriate media. It's a fairly simple process to actually separate sperm from semen. And you also need a good microscope to assess it. From the oocyte and embryo handling side of it, oocytes, they're pretty large. You don't need a compound microscope to see those. You can often see it with a stereo microscope, or what we used to call a dissection microscope, and you can work under relatively low magnification. Sperm requires probably 200 times. Eggs and embryos, you can actually see them reasonably well, maybe 20 times or 10 times. So a lot of work is done on low power microscopes, highly filtered, environmentally controlled surfaces. So each one of these little zones here are heated. When the oocytes and embryos are outside the body, they spend the vast majority of their time in incubators, and incubators are close by, and they maintain body temperature, body gas concentration, which allows pH to be maintained. So this is what our particular embryology lab looks like. Not incredibly complex equipment, but very, very well maintained, and high quality, simple equipment. The egg retrieval and handling, you can work in a number of areas. We happen to have, they're basically like baby isolates. Again, it's got the gas concentration of the body. The temperature is the same. You can use bicarbonate buffered media. The previous one, you need to use artificially buffered media. You can very nicely work outside the body if you've got appropriate media that you're working with. And the first thing from the egg side of it that a clinical embryologist sees is a cumulus oocyte complex, which is an egg surrounded by a fluffy layer of granulosa cells that were right next to the egg inside the follicular fluid of the follicle. And if the follicle is mature, you're going to see, one of these for every mature follicle. And when I do my particular statistics, if an ovarian follicle is bigger than 15 millimeters, which is a decent size thing, more than 100% of the time you get a mature egg from that. Now, 100% of the time means sometimes you get 120, sometimes you get 80, very rarely you get 50% of the time. But overall, that follicle size generates a mature egg and a useful complex. And this is what they look like, projected on a TV screen, and this is maybe 5 to 10 times magnification. If you're looking at what's inside that complex, you need a better microscope. And if we're doing poking a sperm into an egg, you definitely need higher magnification, and you need to take the surrounding cells off the egg. And so this is a mature egg. It's released its polar body. This is what an egg should look like after natural ovulation. We've stripped, denuded the granulosa cells from around it. What you're seeing here is about 120 microns, or 0.12 millimeters. And there would be a sperm in that pipette. So this is a good view of an oocyte, and this type of injection in the world is probably more than 80% of the types of insemination that happens. And if you want to see this by video, here's a little bit of sperm capture. This is using the higher powered microscope, but this is probably 200 times magnification. We've got a micromanipulation setup, so it smooths out the motions of the hands. You attach disposable glass hockey stick shaped pipettes to it, and they've got really good syringe type devices attached to it that apply fine aspiration and blowing. So that's picked up one sperm. There's another guy swimming around. And you can actually, what you're seeing is the embryologist moving the stage to get the sperm that they want, because you can only move these pipettes so far at a time. And I'm actually going to slip on to the next slide. So after you put that sperm together with the egg, whether it was conventional insemination or ICSI insemination, this is a video of a few days in a dish. So a sperm has gotten in there, and during the first night, the second polar body gets released because the penetration of the sperm causes continuation of meiosis. Early the next morning, both half nuclei, one from the sperm and the egg, form. So those are pronuclei. Two of those indicates normal fertilization. And then over the next 24 hours, it divides once and then twice. And then it picks up a little bit in speed. So by the third day, or 3 days after the egg retrieval insemination, it's going to be 8 cells and going on to 16, 32, and some differentiation begins to occur. So these are all totipotential cells, supposedly, if they really got the machinery that it's required and the normal genetics. So during late in the third day and early in the fourth day, of interest here, this is a genetic testing embryo. So during the third day, we put a little hole with a laser into the zona so that when the embryo expands, it creates a spot for cells to herniate out that we can grab onto. Embryos compacted, all the cells have stuck together. They begin to become active, pumping fluid into the center with the tight junctions holding an area that keeps the fluid in there. Cavitation. So you got fluid that's beginning to form. And now you've got 2 cell types, these elongated ones that are the trophectoderm layer, and they give rise to the placenta. And then you've got the inner cell mass, which are the stem cells that give rise to every cell type of the baby. Because we put a hole in the shell here, the fluid creates pressure, it herniates out, and that allows us to grab on something, a few cells that can be used for genetic testing. Okay, so regardless of the work that we do in that lab, a huge part of it is making sure the environment's right. And you have to document it because it's getting more and more successful in our field, but it's way, way short of 100%. And, people want an explanation. Why didn't I get pregnant? So, and sometimes things appear to have gone wrong, even though they didn't get wrong. You get no development. And you want to be able to show it wasn't because of your equipment or your environment. So there's a lot of checklists, a lot of monitoring. All solutions and consumables that come in contact with gametes and embryos have to be verified to be safe. So we need to maintain commercial package inserts that show quality testing of the medias and equipment that we purchase. You have to report cycle outcomes to the clinical teams and registries. And there's ongoing updates that happen, right? Like we look after 7 days, but birth is more than 9 months later. And so you have to follow that up and see how things are going. We do a lot of freezing, gametes, embryos, and people may not come back for some time. They may not come back ever, but they want to make sure they don't need to come back. So you need to make those gametes and embryos safe for a potentially very long period of time. Particularly if somebody froze their gametes prior to cancer treatment when they were young, it might be 10 or more years before they actually consider reproduction, and those gametes need to be viable. Temperature of the room, gas concentrations or pressures. So if we look at the work of a clinical embryologist, data entry and dish device labeling and dish preparation, very exciting stuff, 15% of your time. Patient interaction, verifying that they're actually who they say they are and that it's tagged to the dish that you've prepared, reporting their outcomes, 5%, very exciting. QC and equipment function verification and maintenance, 15% of the time. You're reading temperatures, making sure your gases aren't running out, changing tanks, doer measuring, filling them when they're empty. Clinical team information sharing and communication, 5%. Outcome follow-up, entry and presentation of the outcomes that you've had. Very exciting stuff, 5%. In-house case studies and abstract preparation for meetings, 2% on average. Some people may really take a liking to that and do 4%, and some people may try to avoid it and do 0%. It takes all kinds. Complaining about workload and unpredictable scheduling, 1% of the time, which really seems like a lot more than that if you're lab director. Technical work and the fun stuff, 52%. So you got like 4.3 hours of your 8-hour day doing what I just showed you in the video that you think is cool. Thank you for your attention.
Thank you very much, Dr. Hamilton. Now we will have Cassandra, the alumni of the CE field.
Okay, perfect. All right. Well, hi, everybody. My name is Cassandra. I'm very excited to be here with all of you tonight. I was part of the 3rd cohort of the Clinical Embryology program, and I completed my Master of Health Science in Clinical Embryology at the University of Toronto in the summer of 2024. So we actually had our convocation ceremony in October of last year of 2024. Here are some photos from that. And some fun facts about me. I am trilingual, meaning I speak 3 languages fluently. I speak Greek, English, and French. And I also have a golden doodle puppy named Mango, who I love to show off. Okay, so before we get into sharing a bit about the program, I'd like to share a little bit about my journey. I completed my undergraduate degree in biomedical science at the University of Guelph, where I took a medical embryology course in my 3rd year of university, and I fell in love with embryology. I also did research at a medical embryology lab for my 4th year research project, which focused on mediated methylation in bovine granulosa cells. And because of these experiences, I knew that I wanted to pursue a career in reproductive biology, which led me to finding this program at U of T. I was fortunate enough to be admitted, and I completed my 2 years at U of T and have been since working as an embryologist at a fertility clinic just here in Toronto. I'm very grateful for the role that this program played in my career development, and it offered me a really good blend of in-depth learning, practical experience, and research opportunities, which really helped to set me up for success. And tonight, I'll walk you through my experience in the program, from coursework to clinical placement, and share some insights on where that journey has taken me since. Overall, I hope to provide you with a deeper understanding of what the program has to offer and how it can prepare you for a fulfilling career in embryology. And I'm also here to answer any questions about admissions or the journey ahead, and we'll have the Q&A right after the presentations. So the Master of Health Science in Clinical Embryology is a program is a unique and rigorous program that combines theoretical knowledge with practical hands-on training. The program covers a range of topics, and you learn from experts in the field, which prepares you for the complexity and the demands of this profession. For example, many classes that we had in our courses were actually from guest lectures that were professionals in the field, which was a really, really great way to get to know everyone and also learn from people in the field. And as I mentioned, the program is divided into coursework and hands-on learning. The first year of the program is largely focused on coursework, which provides you a really good foundation of the theory in preparation for your hands-on learning and clinical placement. These courses cover everything you need to be successful, from advanced reproductive biology, molecular genetics, to research methods and ethics. And an example of hands-on learning that you will have in your second year is the Clinical Skills Lab course, which simulates real-world practice and focuses on a different topic each week or each few weeks whenever we switch up to a new one. And this allowed us to practice our skills in preparation for the real world. One of the highlights of this program for me was definitely the laboratory rotation placement at a fertility clinic. The hands-on practicum allows you to apply everything you've learned from courses and the skills lab in a real clinical setting. And during my placement, I worked closely with experienced embryologists. I participated in several procedures, practiced my skills, and observed many trained professionals. I think that this experience was extremely invaluable, not only to gaining technical skills, but also in building confidence to work in a high-stakes environment and being able to see everything that you're learning in class from start to finish in an actual clinical setting. I thought that was amazing that we got to do that. And it's similar to what the PAs have as well, but for the CE program, we don't rotate through many clinics. We rotate through one clinic for multiple months. And so you're able to get a lay of the land in that clinic. So I was fortunate enough to get hired right out of the program as an embryologist, and I'm very thankful to have the skills and the experience that I gained from the CE program. I'll go into my day in the life a little bit afterwards, but I would have to say that this program provided me with really great networking opportunities, including the incredible professors and staff involved in the program and everyone I met at any conferences that I was able to attend. I wanted to talk as well about volunteer opportunities, and there's lots of those throughout the program. I was part of the Canadian Fertility and Andrology Society, or the CFAS, and I think all of us had signed up for that, and we were able to volunteer at different events and conferences and summits and be able to talk to professionals in the field, and that was from embryologists, lab directors, medical professionals. So that was a really, really great way to be able to talk and network and be a volunteer and get to hear really interesting talks about what is going on in the world of reproduction. So currently, right now, I'll talk a little bit about what I'm doing right now. So I'm currently trained in my job, preparing patient charts. I do administrative duties, data entry, quality control, media pouring, and preparing dishes for procedures. I also do sperm preparation, which is the andrology side of the embryology position. And I also am trained on embryo assessments. Right now, I'm currently training on assisted hatching, which Scott talked a little bit about earlier, which was on the day 3 2023 when we used the laser to assist hatch the embryo. And I'm also practicing on media change right now. And in the next few weeks, I'm actually hoping to start on egg retrievals, which are our OPUs, which was something I was able to practice at my clinical placement. And I'll be able to start doing that at my clinic now. I'll also start in the near future on embryo transfers, embryo freezing, and thawing as well. So for my day in the life, I'm currently working in a rotation of 4 individuals who do the exact same thing that I do, which is a little bit more of a junior position in the embryology lab, and we're working our way towards becoming full embryologists. So every day we rotate between the 4 of us. We have different tasks assigned to us, but we do pH and tank checks. We fill tanks certain days of the week in the morning, and that kind of gives us little things to do in between all of our jobs. We split our tasks and we rotate each day, and that's between patient chart setup, media and dish setup, and that's to ensure that for patients and ensuring that all media is not expired, is aliquoted properly with the correct protein, and that's setting up all the dishes for all the different procedures that are going to happen the following day, as well as stocking up everything and making sure that we have enough in case we have a really, really busy week and we can't prepare everything every single day. We also rotate between sperm preparation, which is processing sperm samples for that day's procedures. And we also rotate between the window, which is for OPUs, which are the egg retrievals, and transfers as well, which I will eventually get towards that. I have some pictures for each of them here. So right now I'm working on embryo assessments, which is going in the morning and essentially taking all the patient charts and going onto our embryoscopes or looking in our big box incubators under a microscope. And we go and assess each day of embryos from day 1 to day 7. And so if I were to give you, I guess, a day in the life of if it's like a weekend, let's say, and one person from our rotation is working that weekend, that's kind of how my day would start. I would go in and I would do some assessments to help out the senior team. And then again, the assisted hatching, which is here, assisted hatching with the laser, as well as media change, which we do on days 3 and 5. Next is our patient charts, which I said. So we prepare all of the charts for the following day. And we also do sperm preparation. So we have many different ways of doing sperm preparation. As Scott was talking about earlier, we do gradients, we do swim up, we use Zymot, and we also process testicular surgical samples for microteses or for sperm aspirations and PISAs. And we also do morphology and motility assessment, and as well as sperm count, which is initial and final count. And we also do sperm freezing. And here's some pictures of me from the skills lab doing some sperm prep and some sperm counting. So you can kind of see a little bit here what we get to do in our classes. Next, we have our daily QC, which I mentioned earlier, as well as media preparation. And that was to go in and to prepare all of the dishes for the following day for different procedures. We prepare micro drop dishes as well as embryoscope dishes, which are associated with the time-lapse incubator. So we can actually watch the embryos on a time-lapse incubator each day. And we also do confirming protocols. So if a patient is coming in and they are doing a frozen transfer, we go in and we pull their cryo records and we assess, we compare, I guess, the doctor's notes with our notes and make sure that everything's good. And we confirm all of those protocols. So back to the program, part of our program requirements is a capstone research project where each student had the opportunity to participate and conduct their own research. So my research is on ovarian tissue cryopreservation, and it was specifically on preparing viability stains in order to test the percentage viability of the ovarian cortex before and after freezing it. And conducting this research has given me the opportunity to present at several conferences while in school. These include LMP Research Day hosted by U of T, as well as OBGYN Research Day. And I also gave an oral presentation at the Southern Ontario Reproductive Biology Conference earlier last year. And in November of 2024, I also attended the Oncofertility Consortium in Detroit, Michigan, where I presented my research. And attending and presenting at conferences is another invaluable experience that this program provides, where you can share your work and network with others in the field. And I'm hoping to go to a few conferences this year because my research is still ongoing, and I'm hoping to present that research at some conferences this year. I just have a few tips as well for prospective students, just to kind of add on to what Paulina said as well. I would say I have 6 main ones, and one of them is to highlight your passion. This program looks for students with a genuine passion for embryology and reproductive health, and really show why you love this field of study and why you want to make a difference in this field. Number 2 is to emphasize relevant experience. If you have any experience in biology or lab work, make sure to highlight it. It doesn't need to be directly in embryology. Any experience with research or lab work helps. But again, there have been students that have been admitted to the program with no research and some that have had research. So it's very case by case, but it's definitely helps to have some research as well. Another one is to showcase your resilience. This is a very rigorous program, so demonstrating your ability to handle challenges and stay motivated is always very important. Another one I would say is to be open to learning. The learning curve can be steep, so take advantage of the knowledge and guidance offered by faculty and peers. Another one is to engage in research opportunities. So even if you're not a natural researcher, the process will make you a stronger and more analytical professional, and as well as the importance of networking. So to form connections with classmates, faculty, and professionals during your practicum. And the field of embryology is very close-knit, and these connections can definitely open doors for you and your future in this field. What sets this program apart? So I found that I was very prepared to enter the field and the workforce because of this program. Again, I mentioned the Canadian Fertility and Andrology Society and networking opportunities. Those are very invaluable things that you're able to attain while being in this program, as well as volunteer opportunities and being in communication with so many professionals in the field. I would also say that it's a very small group. There's very collaborative and focused learning, which equips you to think critically and to problem solve in a lab setting. I would say that the Master of Health Science and Clinical Embryology program was such an amazing experience that I would recommend to anyone interested in this field. It was instrumental in preparing me for a truly rewarding career that allows me to make a positive impact on the lives of so many individuals. My journey from the program to now working as an embryologist and everything in between has been incredible, and I'm very grateful for the foundation that this program provided. Thank you, everyone. I'm happy to answer any questions you might have about the program, my experience, or admissions process. You can also always reach out to me at any time with any questions you may have. I have my personal email here as well as my LinkedIn. If anyone had emailed me after the last information night, my U of T email got deactivated, so I may not have gotten your email. So if you did have an email and you wanted to send that to me, you can go ahead and send it to my personal email. Thank you so much.
Thank you very much, Cassandra.